Common Ground, creating equity through public policy and community engagement.
Hi there, welcome to another edition of Common Ground. I'm your host, Lynn Vaughn. Now, if you're one of those people who has made a commitment to improving your health this year, this show is for you. Our subject today is the heart and how to prevent cardiovascular disease. Heart disease is the leading cause of death in the United States. It kills some 2,200 people each day. The Fulton County Health Department is responding by establishing the Healthy Heart Coalition.
The light blue is less than 10% have obesity.
Take a look at the MAPS members of the new Healthy Heart Coalition studied at their first meeting. In 1985, the CDC reports that less than 10% of the population in most of the U.S. was overweight. By 1996, most of the map is darker blue, meaning 10 to 14% of the population in those states is obese. Just 2 years later, in 1998, a new color, red, shows up on the map. In these states, up to 24% of the population is obese. By the year 2000, there's another new color, yellow. In those states, a quarter of the people, or 25%, are obese. This group of health officials and experts has come together because we are literally eating ourselves to death.
Heart disease and strokes are still the number one cause of death in Fulton County. Seem to be headed in the right direction for some ways, but we need to have a discussion to figure out what to do about the things that are headed in the wrong direction.
Guest speaker Mike Miller led the fight to establish the nation's first statewide menu labeling law. Now in California, big restaurant chains must list the caloric and fat content of their foods on the menu.
There's several items that you can get very caught up in nutrition, but the one thing we do know is calorie is probably the easiest, most concise piece of information. And it's simply a measurement of, if I'm going to have the hamburger and the fries and the milkshake, when you look at all those calories, you can say, well, maybe instead of the milkshake, I'll just have a glass of water. I'll save money, I'll save calories, and I can still enjoy a meal.
Here at home, the State Department of Public Health surveyed 4,000 residents about unhealthy food choices in schools and the workplace.
We do have now a basis of public support for some of these school lunch issues. The public was, in general, in favor of reduced sodium, moving fast food restaurants out of cafeterias, and reducing those kind of issues in school systems.
These red and blue states have nothing to do with politics. In Georgia, today, 30% of adults are obese, and Georgia has the second highest number of obese children in the nation. The Healthy Heart Coalition warns we have to exercise, improve our diets, and skip the high-caloric snacks to live healthier, disease-free lives.
Now, when we come back, members of the Fulton County Healthy Heart Coalition explain how they are working to improve cardiovascular health in Metro Atlanta. You'll meet the panel. That's next.
Want some more?
What's he doing?
But he can't.
Look at him. It's just not done.
Please, sir, I want some more.
More? More?
More? Please, sir.
He has asked for more!
Thank you.
What?
Well, he did say please.
Sir? Yes, he did. And thank you.
Yeah, and thank you.
He's a wonderful boy. I do like the boy.
Please, and thank you. Pass it on.
Thank you.
Welcome back to Common Ground. I'm Nazira Dawood, Program Manager with the Fulton County Health Promotion Division. Joining me to talk about improving heart health are Susan Butler, an Assistant Professor with the Emory University Rollins School of Public Health, Gregory Bolden with the Comprehensive Men's Health Initiative, and Swati Mishra, the Health Educator with the Good Samaritan Health Clinic. We are all members of the Fulton County Healthy Heart Coalition. Greg, average heart beats 70 times per minute, 100,800 times per day, non-stop. Since it's working too hard, it's only reasonable that we take a good care of it. Mm-hmm. Heart disease, what is it?
Well, heart disease is one of those areas in which it becomes very important for individuals. It's one aspect of cardiovascular disease overall. When we talk about heart disease, we normally talk about heart attacks, or we talk about irregular heartbeats. But there's also the aspects of stroke and hypertension. And those three areas actually make up the cardiovascular disease when we talk about heart disease.
Swati, do you have anything else to add to heart disease? Because people get confused. Heart disease, cardiovascular disease, what are you talking about?
Well, I think that when it comes to the heart getting its nutrition and oxygen, and heart doing that for the rest of the body, providing oxygen and providing that nutrient, having that being the source of all of that in your system, it is a very, very important part of your body. And mainly when I think about heart disease, I think about having clots or having anything that restrains your heart or restricts your heart to do that job for your body. So although they're different, I think they're very much related to each other.
Cardiovascular disease, otherwise also known as the heart disease, seems to be the #1 killer disease in United States, in Georgia, and Fulton County is no exception. Can any of you tell me, or Susan, can you chime in with the statistics that's available in Fulton County? What's the percentage and how many are actually suffering from morbidity or mortality from cardiovascular disease?
Well, I actually don't have specific percentages for Fulton County. I just know that it's the leading cause of death in Fulton County, cardiovascular disease, and like you say, for Georgia as well as the United States. But I don't have specific statistics on Fulton County at this time.
Greg, do you have anything to add?
Well, I have some of those statistics. The latest data shows that in Fulton County alone, there were over 1,600 deaths associated with heart disease. Now, a number of those were stroke and heart attacks. Those were the primary killers in Fulton County. And it's very interesting because when I looked at the demographics between men and women, it was actually about 50-50. About half and half. And that's running, about the same as with the state of Georgia. With the state of Georgia, we had over 10,000 deaths, total deaths that were associated with tobacco use alone. Out of those 10,000 deaths, we found that nearly 1/3 of those were from cardiovascular disease.
Okay. And the statistics that I looked at showed 950,000 Americans are dying per year because of heart disease. Can we say that's equal to 1 Fulton County deaths per year in America?
Yes.
Is that because the Fulton County population is something like 920,000, and so that's humongous, right?
What's interesting about that statistic, you just said 50-50, half of women and half men. It used to be a men's disease.
Many of us have had our heart broken by that special someone. Yes or no?
Right.
But it can be mended over time, right? But there are certain risk factors that we can avoid to prevent a permanent damage to heart attack or heart disease. Can you talk about the risk factors and the symptoms in a heart attack or a heart disease?
Heart disease, well, specifically, #1 is tobacco, because tobacco contains nicotine, and nicotine raises your blood pressure, and it puts a strain on the arteries of your body. And also the little tiny vessels in your legs, the nicotine destroys those vessels, and that's why some people who use tobacco actually get pain in their legs, that get cramps because of the oxygen not being able to be supplied because of the damage done by nicotine. And of course, diet would be the second thing I would mention, and that includes foods that are high in cholesterol, high in saturated fats, even high in sugar. And I'm a big advocate of reading food labels, and I would like for the public to learn how to do that and make sure that they're not getting too much. They have to be very careful and there's ways of reading food labels that I would advocate for to help prevent that.
It's amazing that Susan says smoking is related to heart attacks, because the public that I speak to, they mostly relate smoking to lung cancer. So people have to be aware that it causes heart attacks too, right? What are the other risk factors in a heart disease?
Well, as Susan was saying, diet is a major part of it, and when you think about sodium as one of the one of the things that they ask you to avoid when you're talking about having cholesterol issues or potentially leading to heart issues, sodium intake in the United States is way more than it should be, and it's way more than the the advised dietary content that it should be. So that is one of the main things that that we can advocate for, and have people make a change in their lifestyle with, because that definitely makes the direct impact to heart disease.
And can I add the lack of exercise, physical activity? Your heart is a muscle, and you have to train that muscle. So if you do exercise that's aerobic in nature, like walking, running, it actually trains your heart. The more you train your heart, the slower it beats, because you're able to push out more blood per beat. So it's an actually training exercise. So this is a very important way to help prevent heart disease, is to keep your heart trained through aerobic exercise.
Yeah. And one of the other things that we forgot to mention earlier was that most people don't understand that diabetes is a cardiovascular disease. And so that's one of the major risk factors. As a matter of fact, a lot of the diabetics that we know actually die from heart attacks, other than other things. So if you're a diabetic, one of the things that we tell folks all the time is to make sure that you watch your blood pressure, watch your cholesterol. And when we say blood pressure, there's a range for blood pressure. Oftentimes we talk about, the normal blood pressure is 120/80. But a lot of people don't understand that there's a range. So for the systolic, which is that upper number, we look for the blood pressure to be anywhere from 90 to 130. And for that lower, the diastolic, we look for that range to be anywhere from 60 to 90. But for diabetics, we try to have them keep their blood pressure well below 120/80 because of the risk factors associated with cardiovascular disease. The other thing is cholesterol. Cholesterol builds up in our system, which blocks our arteries, which cuts off the oxygen to the brain, which can cause a stroke, another one of those cardiovascular diseases. And we can also, what happens is the arteries become blocked because of the cholesterol that's built up and the plaque that builds up in our arteries. So it's very important for us to watch the cholesterol and our weight.
So the diabetics have to be double careful than a normal person who doesn't have diabetes, because what's it's called silent myocardial infarction. They don't have the usual symptoms of what a person goes through when he or she suffers from a heart attack. So saying that, can you tell me more? What are the symptoms? How does a person know he's having a heart attack? What are the symptoms of heart attack?
Well, I'll just say, sometimes the first symptoms is the heart attack because there's no symptoms. And that's what we have to be careful of. And that's why individuals have to have a conversation with their healthcare provider. We can give out information here today, but it cannot substitute for the conversation that they need to have with their healthcare providers. So that's one of the first places. The other one could be a pain in your chest, in the center of your chest. Other symptoms could be a numbness in your arms. For a stroke victim, your inability to speak. So.
And can I mention for women, the symptoms could be different. They could get nausea and back pain, neck pain, jaw pain. It's a little bit less dramatic than symptoms for a man. And also I've heard the number one symptom of a heart attack is denial. They deny that they're having, I'm fine, I just need to sit down and rest. So that's, if you have someone tell you that, then you know that it's possible they could be having a heart attack. But the symptoms are a little bit more stoic with women, and it's not as dramatic as with men. So you have to look out for that for women.
Swati, I'm sure you heard of people saying they've had gas. They just thought it was gas and they just left it alone. Have you heard much of that from your clients?
We have not but as you bring up, it's one of those things that is very much important for us to bring out in the open so that people are aware of that. And even if it is something small, it is very important to not discard it as something unimportant, because even the smallest thing could be something building up to that big heart attack. And every time you get a heart attack, your heart is getting weaker. So it is very important to prevent that ultimate heart attack. So any symptom is important.
Let's take a break now. We'll continue our discussion on heart health in a moment.
Come on, man.
Just do it quick. No one's watching. You have to if you want to hang with us.
The other one, too?
Good job. Do the right thing. Pass it on. A message from the Foundation for a Better Life.
Welcome back to this special edition of Common Ground. I'm Nazira Dawood. My guests and I are talking about ways to improve heart health and reduce death from cardiovascular disease. Greg, Swati and Susan, they say laughter is the best medicine, but somehow it's not covered in our health plans. Okay? What is the best way to prevent heart disease? Swati?
I think as we have touched on a number of bases already when it comes to preventing, avoiding smoking, having a good nutrient base, having a good nutrition plan, and one of the other things that we would like to add to that is one of the common treatments is taking aspirin, which is a blood thinner, and a low dose of that on a regular basis, which just regularly prevents your heart from getting that blood clot. So I think the main thing or the main lifestyle change that we can promote or have individuals make is that change in their diet, because that is what prevents you from building up that clot, taking good care of your heart, and also fitness, health and fitness. That's a big one.
Do you have anything to add, Greg?
Well, I was just going to say, because we were talking about a little bit, she just touched on it, exercise. If we can get out and get 30 minutes of exercise on a daily basis, and I'm not talking about going to the gym, running a marathon, pumping a lot of iron. If you can just get out and get a brisk walk in for 30 minutes a day. I tell some of my clients, I say, go out and walk your dog every day, even if you don't have a dog. Mm-hmm. Make sure you walk your dog every day. Those are the easiest ones to pick up after. So exercise is one of those areas that we can actually do, everyone. Mm-hmm. And if you smoke, stop smoking. Or if you drink more than two drinks a day, more than 2 drinks a day raises your risk of having a heart attack.
So it looks like all the risk factors are preventable, right?
Yes.
Managing stress, you can control your blood pressure, know your screening numbers for diabetes, etc. Heart disease at some point was known to be the older man's disease, and it's not anymore. It's equally common in men and women. Do you have any statistics, or can you talk about the gender disparities in heart disease?
Well, like we mentioned earlier, it was usually known as a man's disease, but because what I'm reading is because women now have joined the workforce and don't have time to do a lot of healthy cooking, they are also working many hours and having to go by and get fast foods, maybe something quick and easy to take home. They don't take the time to exercise. It's the same symptoms that men have been having for years, so they're just catching up. And a lot of also stress and anxiety can lead to heart disease as well. If you're constantly under stress and you're anxious about something, and your mental health is very important to take care of your mental health. So women, again, have succumbed to the mental health aspects of heart disease.
One of the things that, because you touched on something very interesting, because with women actually went into the workplace, but they also started smoking. They took up the smoking, and so there was a great increase in the number of women smoking. Plus, you had the added stress of going to work and then coming home and taking care of the family because they didn't put that down. So now, with women, you have your heartbeat that's raised during the stressful hours of work. Now you're smoking, then you come home, the stress level just doesn't come down. And we're finding this is prevalent actually more in African American women than other groups because it's never turned off, which leads to more heart attacks.
Can we say younger men and women are more prone to heart attacks much younger now because the obesity is way high up? Obesity in Georgia for children is second highest across the nation. So would it be right to say that we might see heart attacks, the age range differ going to the younger generation?
Sure. The weight is very hard on the heart to carry so much weight, and having to pump the blood throughout the entire body with each beat, and being overweight, it makes it harder for the heart to work efficiently. So that's why that's so much related.
And like Swati mentioned earlier, our diet. We have a fast food diet. We don't eat as many fresh fruits and vegetables like we did in the olden days and like we should do. We eat more fatty foods. We eat more processed foods. All of those things contribute to cardiovascular disease.
February 3rd is Wear Red Day for Women, campaign to reduce heart disease. So do you think it's unfair that we don't have a Wear Blue Day for men?
Oh, definitely. But we're working on that.
Okay.
Because you have to understand, men didn't move into the health fields and start focusing on our health until later because we're macho men. I mean, we grow up and said, if you're a young kid, they tell you, if you fall and scrape your knee, oh, boys don't cry. And you go into high school and you get into sports, oh, suck it up, And then when they get older, it's like, okay, I have this little pain in my chest, but it'll go away. And so we need to have a Wear Blue Day for men.
It was about 1990 when women were even included in research on heart disease. It was usually, they only used men, and in 1990 that changed. They started including women in research related to heart disease. So it was interesting that they only thought that men got heart disease at one time.
Okay. I've learned the importance of nurturing and forming partnerships, coalitions, collaborations in order to make a huge impact in a community, especially in the chronic disease sector. So tell me, as a co-chair for the Healthy Heart Coalition, tell me what's Fulton County doing about the prevalence of heart disease in Fulton County?
Well, one thing we're emphasizing is possibly a change in policy. The schools are evaluating the fitness levels of our school children, and if we can work with them and not only just inform the parents, but actually make changes there at the school in terms of the nutrition in the lunchroom. And if they could have possibly salad bars and healthier choices, low-fat or non-fat milk, and not so many French fries is what we're hearing about. If they could offer better nutritious meals in the lunchroom. And really what we would like to see is more days of physical activity, of PE. And I've learned that it's like 1 year they have to have PE as required. I think it would be great that they should have it throughout their entire school life, is to have PE.
Right, and you both have been to our coalition, you attended our coalition meeting. We are going for that policy change, systems and environmental changes, as Susan mentioned. As a health educator, what are the challenges you faced on educating patients about even kids about, stop smoking. It's not good for you. It's not about smoking. Do you know your blood pressure? Do you know your cholesterol number? So what are the challenges you faced while interacting with your clients as a health educator?
Well, every day when we interact with children, or a lot of times the child's everyday upbringing is actually directly connected to their immediate environment. So their parents, their school, their home, everywhere they play, learn, and where the parents work. So what Susan was saying with the policies and having good nutrition at the school, that is a very important policy for us to push, because that is where the children spend most of their time. So that is very important for us to do. And the challenges that we face is, of course, when you educate, you can say, okay, this is what you're supposed to do. You're supposed to exercise. You're supposed to have good nutrition. But for them to follow up, and for us to follow up and not kind of, leave them hanging when it comes to that. So I think follow up and keeping up with that is the biggest challenge.
Go ahead.
And I was just going to say, as part of our coalition, we have certain partners that are working with us. For example, the state has now gone out and said that they want to do more work with the faith community. And one of our other partners, the American Stroke Association, American Heart Association, is also working with the faith community. For example, on February the 25th, they're going to be having a gospel concert with the Gospel Music Workshop at Jackson Memorial Baptist Church. And what they're doing is they're using that avenue to actually go out to the community and directly educate the community. So there are a number of other things that are coming up throughout the year where we're actually going out and educating the community directly, simply because we have to get the word out to our community, and we have to use those avenues that we have access to.
Is the Healthy Heart Coalition open to public? Can the community members join from Fulton County?
Yes, sure, we would like for them to. And I would challenge viewers, I would like for them the next time they go grocery shopping to please start reading labels. Check out how much saturated fat, anything over 3 grams, too high. Sugar, checking for sugar, anything over 500 milligrams is way high in sugar and sodium. A lot of frozen foods are very high in sodium, and I would challenge them to please start reading labels.
Well, that's all the time we have for now. I'd like to thank you, Swati, Greg, and Susan, for providing such invaluable information to our viewers today. If you or your organization would like to join the coalition, or if you just want more information on achieving and maintaining a healthy heart, stay tuned. Lynn will have the contact information for you after this break.
May I walk you across the street?
Sure. Thanks.
Our thanks to Nazira and the Health Promotion Department, as always, promoting good health. And thank you to the other members of the Healthy Heart Coalition of Fulton County for their time and their hard work on this issue. Now, here are the numbers to call if you want more information. To join or work with the Healthy Heart Coalition of Fulton County, call the Health Promotion Division. That number is 404-613-1243. And to visit any one of the 8 Fulton County health clinics nearest you, call the main number, 404-612-1211. We thank you so much for joining us and joining in the fight against heart disease. I'm Lynn Vaughn. We will see you next time right here on Common Ground.